Hello and welcome to today's episode of Life Saving Procedures. Today we'll be looking at fainting in children. What is fainting? Fainting is the temporary loss of consciousness as a result of a sudden reduction in blood flow to the brain. Okay, what are the common causes of fainting in children? Number one is dehydration. Number two, a child who have been standing for so long. Number three, a child who has not eaten at least for 6 hours because reduced blood glucose level can lead to fainting. Other causes of fainting, for example, anxiety, fear, panic, okay, or maybe the sight of something that triggers anxiety. For example, some children can see blood and pass out. Now, it is important that we differentiate between fainting in children and an unresponsive child, okay, because what you do in the two situations are very different. For a child who just experienced fainting, even during the process of fainting, you will notice that this child is still breathing and the pulse is still being felt. Okay, so you check the chest wall, you notice the child is still breathing, the chest wall is moving outwards and inwards. You feel for the pulse. Okay, for younger children, the best place to feel for the pulse is the inner part of the arm. Okay, you place two fingers across the middle of the inner part of the arm, you feel the pulsation. While for older children, you look for the carotid pulse. Where is this carotid pulse located? It's located around the neck, the angle between the lower part of our jaw, okay, and our neck. So just trace the lower part of the jaw, and where it joins with the neck, that's the best place to feel for the carotid pulse. So with two fingers, you place across the junction between the lower part of our jaw and our neck. You put your fingers there, you feel the pulsation. Okay, that's how you know that this child is not unresponsive but has just experienced fainting. Okay, whereas for an unresponsive child, you will notice there is no breathing. You will notice that you cannot access or feel the pulse. Today, we are focusing more on fainting in children. Now, there are a few practices that are unfortunately harmful to a child who is experiencing fainting. Okay, number one, do not start pouring cold water or any form of water on the head of the child. Number two, do not try to place them in a sitting position or standing position. Number three, please do not put anything in their mouth. Three, please, that's not when you should carry the legs of the child and be putting in fire or be using something hard to hit the child. No. Okay, all you need to do is ensure this child is placed in a safe environment on his or her back. Let the child be lying flat on the ground on their back. Okay, but in the event of vomiting or any substance coming out of the mouth of the child, please lay the child on their side, the left lateral position. Left lateral position means that this child is lying flat on the ground and you tilt the child to the left side. Okay, this will help to reduce aspiration, ensure there is enough room for ventilation, and ensure that the environment is also safe for both you, the rescuer, and the child. Next, you check for tight clothing on the child. Ensure these tight clothing are loosened or removed. Raise the legs of this child to be above the level of the heart. So if a child is lying flat on his or her back, okay, it is easy to raise both legs up so that it will be above the level of the heart. Remember, the heart is in the chest. So what you're basically doing is raise the legs up above the chest. That way, you are raising the legs up above the heart. Okay? And the last thing to do is to call for help. So you continue with the legs of the child raised up until help arrives or you've gotten to the hospital. When a child experiences fainting, the primary cause of this fainting must be identified and properly addressed. Okay, I hope this video helps someone out there. Cheers.